Hi, I'm Dr. Jaclyn. I'm a general dentist at Dental Designs, and today we are going to talk about if you need to do a root canal treatment before you get a crown done. The short answer is no, not always, but let's just break down the question into two parts. So the first part of the question is talking about root canal treatment. So root canal treatment is usually done when the nerve of the tooth is inflamed or it has become infected. This can be caused by things like a very large decay. It may also be caused by a crack. Usually these are the two main reasons why a tooth would need root canal treatment. How would you know if the nerve of the tooth is affected by the decay or the crack? Usually the tooth will start to become very sensitive, so even room temperature water may become painful. There may be pain even when you're not doing anything. A lot of patients will report that in the evenings or when they're trying to go to sleep, the pain from an affected tooth will become worse, or it may get worse with exercise. Later on, when the nerve of the tooth has died, usually this kind of spontaneous pain will stop, but the inflammation caused by the dead nerve can spread to the tissues outside of the tooth, and now the tooth may become painful to bite on as well. So there is continuum. Some patients may experience spontaneous pain and pain on biting at the same time, depending on what's happening to the nerve of the tooth and the surrounding tissues at the same time. So once the nerve of the tooth has become severely inflamed, causing this kind of pain, then if you would like to keep your tooth there, we have to deal with the inflamed nerve by removing the nerve tissue but leaving the rest of the tooth intact. So this process is designed to help you to keep your teeth, and this is the process that is referred to as root canal treatment. So I will briefly go over root canal treatment. It's not really in the scope of this question, but it can be broken down into three stages. The first stage is to remove the inflamed nerve. The nerve of each tooth is found within the root canals. That's why we call it root canal treatment. After the nerve is removed, the root canals, which are now empty, have to be filed so that we can disinfect the root canal system. After the root canal system has been cleaned and disinfected, usually we will put some kind of medication inside to further kill any bacteria. And once the root canal system has been fully cleaned out, we need to fill up the empty root canals. We don't leave them hollow. This is to prevent the future ingress of bacteria. So that is root canal treatment in a nutshell. You do not always need to get root canal treatment before a crown, but the teeth that end up needing root canal treatment are usual candidates for crowns. The reason being, crowns are usually done for teeth that are quite badly damaged, so usually teeth that have been filled multiple times in the past, or teeth that have had root canal treatment because of a large cavity. So once the tooth has been drilled to remove the decay, it becomes weaker. And after root canal treatment, because the nerve in the middle of the tooth has been removed, most patients, they can bite a lot harder on a root canal treated tooth versus a tooth that has not had the root canals treated. So these teeth are more fragile and they are subject to more force than usual. So this is the reason why after root canal treatment for a back tooth, usually a crown is advised. The same goes for a cracked tooth as well. So the root canal treatment process can actually worsen cracks because it makes the tooth a lot drier and more brittle. So a crown is really useful to keep all the cracked pieces together. Now, if your tooth has not had any large decay that reached the nerve, or there's a superficial crack that hasn't affected the nerve yet, you can choose to do a crown without needing to do root canal treatment first. I do this very often. A lot of patients may have the idea that if they just do a crown without doing the root canal treatment first, it means that root canal treatment is more likely to be required in the future. That's not entirely true, because usually the teeth that would be candidates for crowns already are badly damaged. That's the reason why we would advise you to crown such a tooth. It wouldn't make any sense for us to crown a perfectly healthy tooth or a tooth that maybe has some minor decay that can be treated with just a filling. So the teeth that end up needing root canal treatment and the teeth that need crowns, they tend to have some kind of overlap. Your dentist will be able to advise you in your specific case on a tooth-by-tooth basis, because this can vary even within the same patient, whether they feel that root canal treatment might be necessary before you get a crown done, or whether it's possible to skip the root canal treatment process and go straight to a crown. There are some benefits to skipping the root canal treatment process because, as I said, root canal treatment does weaken the tooth in the long run, and root canal treatment is actually quite a complex and very delicate process. So doing root canal treatment does come with its own share of risks and complications. So if possible, we want to avoid exposing the patient to that unless it's absolutely necessary. So again, to summarize the answer to this question, it is not always necessary to get root canal treatment before you get the crown done. Root canal treatment is done to remove the pain or the infection that's coming from a dead nerve or an infected nerve, and very often after that the tooth will need a crown. But it is also very common to do a crown without having any root canal treatment done prior. This does not mean that in the future you may not require root canal treatment, but if the case is properly managed and the tooth is not so badly damaged, I don't think it makes any sense to do root canal treatment if there's no signs that the nerve is infected or dead.